Despite the decline in maternal mortality rates in Uganda, 343 out of 100,000 mothers do not live to hold their babies. Today on the show, we have Dr. Ruth Balamezi, a mother of 3. She is the head of team at the Nerves and Bones Rehabilitation Center in Tinda. Welcome, Dr. Ruth, to the show.
Thank you.
I would like to ask, in your view, what would you define or how would you explain postnatal care?
Okay, postnatal care is just, in a nutshell, the care to the mother and the child. Why the mother? The mother goes through a lot while carrying the baby, or what we call normal physiology. Everything changes right from the heart, the vessels, the bones, the muscles. They all change so that they can cope with the stress of carrying the baby. So when they release the baby, when they give life to the baby, then this mother needs to get back to her normal self. That's why the mother needs that care. And then why postnatal care for the mother and the child? The child is new in the world. That baby needs to be like initiated or carried on to the world.
Okay. What are the most common health concerns and risks that new mothers go through, and how can this be bettered?
There are quite a lot, but now the ministry recommends that most people deliver from health facilities. But some of them are shock, hemorrhage or overbleeding. Those are the most dangerous ones. But I want to look at this mother because most of them are curbed from the hospital. How about when you're at home? What are the signs that you can look out for to say that now my friend or my child or my sister is at risk? For example, if they get cold, their feet, if the pain is so extreme, if they are not breathing well, they get a blurry vision or they cannot see well, a lot of dizziness, a lot of pain. For example, it could be a very striking pain or headache. To be a sign of a clot or anything else. If you see those signs and symptoms, you just go to the medical facility. Other than me telling you about shock or that you may not know that this is shock, I would want you to pick up the signs and symptoms that you can look out for and refer someone as fast as possible.
Okay. Though it seems that by the time that's happened, are there any cases where that are earlier on, pre-extreme? Because now by the time you're saying hemorrhaging or a lot of pain, are there common telltale signs that can be spotted earlier on, in which cases you tell a mom you need to see a doctor because ABCD is happening before the symptoms become so exacerbated, severe that she may not even be able to take herself to hospital before then the issue becomes so dire?
Okay, let's go back to this mother. What happens after delivery? We are looking at eliminating as much pain as possible and creating a fast restoration of function. In function, we are what some people say getting back. All that is restoration of function. So normally the pains come in. That's why locally they press with the hot thing, just to calm down the pains, to soothe the muscles, to help you relax. And then what else would happen? Since there is bleeding and a lot of in and out has been happening, infections can occur. So if infections are to occur, the first thing the body will do, our bodies are fighting all the time. It is a mechanism that fights. So the first alarm the body will send out to is the increased temperature. Because the body is so funny, it will increase the temperature to kick out the bacteria.
And we have thermometers, but we don't use...
To kick out the bacteria. So in that case, if the fevers are setting in, that is an alarm. That maybe there is an infection. It could be local. It could be a sepsis all throughout. So just your fever, that's an indicator. Then we look out for the pain because we are eliminating the pain. She has gone through pain. And most people think that after delivery, all the pain is done. We have been mothers. The pain is just starting, including us. So there's some tolerable pain. I always tell people on a scale of, we call it I always say that on a scale of 0 to 10, if 0 is no pain and 10 is extreme pain, where is your pain? If your pain is above 6, please go to the doctor. So that the painkiller cannot control that pain, go to the doctor. But if the pain is tolerable, then you can work around it. The painkiller can do and all that. Maybe also, let's highlight who will be working on this mother.
Yeah,
we're looking at the gynes have been there. There's a big team that should work on the mother. Yeah. Unfortunately, in Uganda, those teams are not so respected. But we have maybe the doctor, we have the nurses or the midwife, we should have a physiotherapist, an occupational therapist, and a nutritionist, as well as a psychologist. Wow. That should be the team that works.
Wow. Wow.
So each one of them, ideally during the visits, each one of them should usher us what are the key things that you should look out for. So the concerns are around that if any of that, if you look out, okay, now what we do is like WHO, they recommend folic acid for the iron, but that's just a tip of an iceberg. This mother needs a lot. But I like our mothers, although ancient, they tried. Yeah. My problems are with we, the modern moms. We do not want to do the traditional things, yet we are not moving upscale to the real modern world, because the real modern world requires for such a team to be running around this one mother. Yes. So we are half-baked, or what we call lukewarm. Wow. And that's where the problems are coming.
Wow. Anyway, I'm glad you decided to talk. You know, now I got into like, is she talking about like mumbo and stuff? Yeah, because I'm those moms. I'm like, oh, I don't want. And yet I didn't take folic acid after the baby. Anyway, I guess that's another discussion. But I'm glad you decided to talk about the kind of psychological factors around a mom. In the recommendations from World Health Organization, there were things such as, you know, look out, you know, from the mom, if she's going through possible domestic violence, looking at aspects of sex after delivery. What are your recommendations, or give us some light on the best practices in our local, you know, in our existing health environment? Like, how should this work?
I will view domestic violence in two aspects. Most times, domestic violence is viewed only from the physical aspect. Am I beaten? Am I this? But there is a lot of emotional abuse that can come in. I should confess that I suffered that kind, in a way, of emotion. I have 2 girls, and when I got my 3rd girl, everyone said, you've not delivered. You can imagine if you're mothers. And they're telling someone, and because I am empowered, I knew I have delivered. I am a woman who is very, very important to my family and the nation at large, but so many women go through that. And our hospitals look out mainly for physical violence. Yes. And most people are just looking out for physical violence. But emotional violence is actually more painful than the physical. Because you can heal that pain, but the emotional pain is different. You can imagine telling me that you've not delivered. And they were bold enough to tell me that. So I know so many mothers out there will suffer. Yes, because when we go home, we are not doctors. We are not anything. We are mothers. Wow. So someone will come to and say, 3 girls? You're so unlucky. Can we pray about it? I'm like, why should we pray about it? It's, you know? So, oh my God. So it can happen.
It's amazing that still happens today.
Yes,
it's happened for a very long time.
But I'm very proud of my girls. I'm like, you'll be the most excellent women. You're women of valor, just like your mom. You'll be
come on now. That's very nice.
Yes.
Mothers don't seem to get enough guidance on the expectations about, you know, postnatal. Do you think more should be done?
Of course, a lot should be done, and I am very, very proud of you for starting this show. It's very, very good because you're looking out for the mother, especially. Yes. Ideally, because we somehow feel we are empowered. Our society is so empowered. There's a time I was talking about loneliness, and they told me, in Africa, how do we get lonely? We are surrounded with so many people. Until I highlighted the emotional aspect. Yeah. For example, there are many people there who say, maybe if you're the age of 35 and you have no baby, your friends will start saying, you have no baby, you're pushing that person in the corner of loneliness, even when it's not so. So bringing it back home to our new mother. Our new mother, we talked of the team of the gynecologist. We need the midwife. We need a therapist. We need an occupational therapist. Now, I'm going to highlight just a few roles. We know, okay, the gyne will help you deliver safely, as well as the midwife. But then we need a nurse to check out for those critical things that may occur to you. While the nurse may not be there, we want to equip the caretaker or someone close to you to take care. And most times our mothers are doing it well, although haphazardly, but they try to look out through experience. Then you're looking at this therapist still. The key role is how are we eliminating as much pain as possible, because the more this mother is comfortable, they'll give quality care to the mother. You've heard about this saying of sleep along with the baby, because they want you to rest with the baby. Look as it is
Sleep
okay.
when the baby sleeps.
Yes, it is okay. It tries, because you're giving it a lot of energy working on the baby. Actually, we need as much support as possible. Because I normally get support because I need my me. I love my me so much. I really love my me. So we are looking out, okay, pain, and how are you restoring your function? Your function includes you. You have seen people who cannot move well. I treat so many people whose back started after delivery, because that's my specialty. I treat so many people whose hips are no longer the same from the time they delivered. What happened to that? Because of the pelvic floor, they carry a lot of weight. That's why I said that everything changes. Because as we are preparing for delivery, the muscles tend to sublux, to become a bit loosened to allow the flow of the baby. Now, getting back on shape is another thing. Yes. And then we don't want stress for the mother. Already, the heart grows bigger, the veins become dilated or bigger. That's why most people have a low blood pressure during pregnancy. So there's that aspect called normal physiology, but how are we ushering the mother? So now this therapist looks out for such ailments and helps you get back to the road as possible, as fast as you can. And yes,
sorry,
you have something?
Yeah. Could I ask, when you say that your vessels grow larger, your heart grows larger, when you have the baby, you go back to normal, right?
Yes, that's the period of 6 weeks.
Supposed to go
and that's the period of 6
to.
weeks. Why the 6 weeks? We call it a period of puperium, where the body is shifting back to normal. That's why we need that monitoring. Yes, even after 6 weeks, life is okay, but those are the most critical weeks of summer, especially the first week. The first week, then the other weeks, because this is when everything is getting back. We actually discourage as much stress as possible for the mother to allow things.
Sex is not stressful.
Oh, speaker, talking about sex. Okay.
Why I was asking this question, because, you know, our bodies don't go back to the way they were. So I'm wondering, some of us who've had multiple babies, are our hearts a bit...
No. Actually, your heart goes back. They all go back. What you see is just the muscle.
Okay.
What you see is just the muscle, which was just overwhelmed and it's getting back. But the other things, because everything changes, the kidneys change, everything, and it gets back to normal.
And you're saying the tummy didn't go back, so did other things go back?
Which is what I wanted to ask.
Yeah, she's like
kind of brought
muscle.
it up in the conversation.
Yeah.
So we have genuine health concerns. Yes, fine, the pain, everything to do with our internal organs, etc. But then as women, you know, we also have some cosmetic issues, you know, like getting back into shape. I think is every mom's first issue of banana, this thing. When is it going to go back? And something else which I also hear moms talk about, women especially who carry to term and maybe have vaginal births. There's also the vagina tightening. You hear people saying, banana, how will sex be after this? How do I get back into, you know? So I just wanted to find out if we have any form of, I know you deal with patients after they've given birth. If there is any like therapies that are there, how genuine, how like legitimate are these non-health concerns, and what moms are usually advised about them?
I'll call them health concerns.
They still are health concerns.
Yes, although not major, but they are there, a bit cosmetic. Actually, getting back on shape takes. Let me start with the tummy and your body. If you exercise, but don't stress it. I actually tell mothers, your pressure should start after 6 months. 6 months now, give your body that push. But before 6 months, you're just overwhelming yourself. Actually, the body has a pace, because you've spent 9 months carrying someone, giving life to someone. At least give yourself 6 months, eat, breastfeed. And actually, breastfeeding is one key factor that takes us back to normal. And And then, yes, and then you walk around, of course, the normal workouts. Although if we clock above 30, I don't want you to do sit-ups. They will just make your back sick. You'll lose the tummy, but your back will get a problem. Then with the vagina tightening, there are actually so many therapies around it. Recommended, leave alone the chemical. I would regard mothers to run away from the chemical things that they sell. Yeah. At our place, we have machines that help, coupled with the Kegel exercises. There's technology for it. Is it? Yes, and it's there. Actually, not just for mothers.
Want to do some 10 while we are seated? I'm Kegeling.
Yes, now, actually, not only for the mothers, but we know that the vagina is covered with muscle. Muscle can expand and contract. So even if you're gone for C-section, that place is working almost every night. For some women, it works every night. For some, only weekend. But that muscle can become... Yes. For some, that muscle becomes elastic over time. So it needs a bump. If you can take care of your stomach, what about that special muscle? So it's a treatment that you can give yourself, even when you've not delivered vaginally. So it's actually, when you get to close to menopause, you will see the value of that muscle very well, because you want to revive it. Yes. So for so the Kegels, like any other exercise or all that, they should be coupled with some technology that will facilitate, and it is there. The machines are there.
Thank you so much for joining us, Dr. Ruth. We've had an amazing session, both educative and informative. And I'm pretty sure there's a young mother out there who has been able to answer some questions. We'll see you next time. With love from Bump Love.